All right, so for question number one, it's describe the role of communication in counseling and the implications of the differences between the client's and counselor's culture and worldview. As Hayes and Erford in our books in 2018 state, most of the major counseling theories rely on spoken words as a primary tool for promoting growth and change. This can be found on page 16. Most people think of talk therapy whenever they hear words such as therapist or counseling, uh, which is why communication is very important. Communication is very important in counseling because it's how people mainly express their thoughts and feelings and how counselors are able to communicate back. We also have other types of communication, such as nonverbal communication. This is important for counselors to understand, especially when seeing clients with a different cultural background than their own. This is important because, for example, as Hayes and Efford give us in page 17, they give the example of how lack of eye contact can indicate shame or depression in Western cultures versus Eastern cultures, it indicates respect. Question number two, describe cultural identity and its relationship to the counseling process. There are many factors that make up cultural identity. For example, race, ethnicity, and gender. They play big roles to one's unique cultural identity. According to Hayes and Efford, it also contributes to a person's interaction, experiences, worldviews, and beliefs. All of these are important for or it's important for the counseling process because it helps counselors be culturally competent. Being culturally competent helps you relate to your clients as well as to yourself, which is very beneficial in a person's therapy.